here at the Pan American Health Organization, and connected virtually also Heidi Jimenez, our legal counsel, Office of the Legal Counsel at PAHO, as well as our invited speaker, Pablo Seriani Cernados, who is a member of the Committee on the Protection of the Rights of All Migrant Workers and a member of Families Office of the UN High Commissioner for Human Rights. To open our event this morning, I'm going to pass over to Dr. Jarbas Barbosa, the Assistant Director of the Pan American Health Organization. Dr. Barbosa.
Thank you, James. Good morning to everyone joining us today, virtually around the world, as well as here at the headquarters of the Pan American Health Organization in Washington, D.C. It is an honor to welcome you to this event as we officially launch the PAHO WTO information platform on health and migration in the Americas. A special welcome to Santino Severoni, Director of WTO's Health and Migration Program, who is here with us from Geneva. I also take this opportunity to thank Pablo Seriani Cernadas, member of the Committee on the Protection of the Rights of All Migrant Workers and the members of their families at the Office of the UN High Commissioner for Human Rights for joining us virtually today. The Americas face one of the largest displacement situations worldwide, with more than 6 million Venezuelans residing outside of their country of origin, as well as other continuous intra- and extra-regional migration flow patterns that affect nearly all countries across the region. As we recognize the history of migration and its contribution to the development of our communities, we must also recognize that throughout the mobility continuum, migrants are often exposed to a wide range of factors that jeopardize their physical, mental, and emotional health. Today, millions of migrants in the region are facing challenges at every stage of the migratory process without access to primary healthcare services, medicines, vaccines, or mental health services and psychosocial support. Linguistic and cultural differences and discrimination are among the numerous barriers hindering the timely access to critical care for migrant populations. This is compounded by poor living and working conditions, which include limited access to sanitation and safe water, among others. The COVID-19 pandemic has exacerbated these challenges, as well as pre-existing inequalities. It also highlighted the unsolved issues that need to be addressed in order to uphold the right to health for all persons and to protect public health gains. Among these issues is the limited availability of reliable and accurate data on migrants' health needs and the scarcity of evidence on priority health topics within the context of migration. Efforts must focus on collecting and applying the most robust data gathered to better prepare for and respond to a wide scope of health issues. PAHO, hand in hand with the Ministries of Health and partners in the region, continues to intensify its support to countries in the development of transformative policies based on universal health, as well as in the implementation of public health interventions that address the most pressing needs of migrants within the context of our commitment to building resilient health systems. PAHO has mobilized teams on the ground to support critical areas, such as strengthening the capacities of authorities providing care to migrants, the organization of health services networks in border communities, the procurement and delivery of essential health supplies in areas with high population movements, and the enhancement of health surveillance. These efforts have included supporting the migrants' inclusion in all aspects related to the COVID-19 response, as well as our continuous advocacy to ensure equitable and non-discriminatory access to vaccines. As we look ahead, let us not forget that exclusion is costly and undermines our public health achievements to date. The COVID-19 pandemic has been a stark reminder of this. Therefore, the investments we make today must be made using a rights-based approach that supports the integration of the health needs of migrants in national policies and legal frameworks, social protection measures, information systems, and preparedness and response plans. The information platform on health and migration in the Americas is intended to support the countries as they advance along this path, galvanizing action to protect the migrants' health, the health of population in host countries, and to move us closer to achieving universal health for all. I would like to conclude today by congratulating the different technical teams at PAHO, especially PHE and HSS and all the other departments that were involved on this very important initiative, and giving special recognition to the research teams at both the University of Torquato de Tella in Argentina and the Universidad del Desarrollo in Chile for their immense contribution to the development of this information platform. Thank you all for joining today's event. Thank you.
Thank you very much, Dr. Barbosa, for those opening remarks. This initiative, although a regional initiative, is very much framed within the global response, the PAHO WHO global response to improve health and migration within the region of the Americas. We're really pleased to have here today with us Dr. Severoni, who is the director of the program of health and migration at WHO, who will give us a general overview of the context within WHO globally, and to position the discussions that we're going to have here this morning on the actual platform. Dr. Severoni.
Thank you. Thank you very much, James. Dr. Barbosa, thank you so much for your kind introduction. And Ciro Duarte, it's always a pleasure to be with all of you. I'm delighted to be here with you today, not only for the pleasure to launch together a new initiative, but also for the technical relevance of this initiative. And if we are looking very quickly to the global landscape, the situation, I would say, it's on evolving mode. A few years ago, health sector was not even taking part of the debate at national level in relation to the public health aspect of population movement. Today, health sector is a competent and aware key stakeholders in managing migration movements. So situation is changing, and thanks also very much to the enormous investment in shaping up capacities, promoting knowledge sharing and research. And this tool is exactly linking to those initiatives. But I have to say that still more need to be done to relax and to say we have achieved satisfactory results. Dr. Barbosa before was alluding to the COVID pandemic. COVID pandemic have been a tremendous, painful public health lessons for everybody, for all of us. In a way, accelerating the understanding at the country level of importance of universalistic approach, which includes also migrants and refugees, regardless the legal status on which they're living in the country, if we want to promote a sound public health interventions against the pandemic. But also COVID has explained to us that legal frameworks, policies, barriers of access to service and health systems are still there. And we need to be extremely proactive to overcome them. And this tool is an enormous resource because becoming a very handy repository and a collection of those informations, which also very useful to have a trend type of reading of the situation at the regional level. I would like also to briefly reflect on another point, the research and data. There is a quite important reference to those elements in the PAHO information platform. This is certainly a priority also globally and for all regions. Actually, when I say globally, I always sort of intend that we do this hand in hand with the region. So investing into research and investing into producing of meaningful data. The reality today is almost of an emergency, because we are having in front of us a level of fragmentation and incomplete set of data that it's very difficult to offer them to policymakers or decision makers and to use them for a rational decision-making process or policy designing. We are trying to fill up these gaps, and indeed the PAHO platform can be a very important tool in that regard. Actually, revising and juggling a bit with a tool, I believe that this initiative has a very important potentiality, a benefit for WHO. When I'm saying WHO, also for the other regions globally, that when a good idea is there, we should invest into this good idea to make it global and to make it relevant for the entire organization. So I'm really looking forward to work together with James, Ciro, and with the regional office as a whole to build up on this experience, to see how far we can go, also facilitating, supporting our regions. And as you know, the area of research and evidence is and data gathering is a priority for the global program. So probably the initiative of PAHO could be a tool that we can, let's say, globalize in order to make it available for the entire world. Thank you very much once more for the opportunity to be with you, for sharing this wonderful initiative with a very interesting potentiality. Thank you very much, James.
Thank you, Santino, for those remarks. Certainly, I think we do have a very important opportunity to share this experience globally. One of the central components of this initiative has been really to frame the work around health and migration within the legal, legislative, and regulatory frameworks within the Americas, looking at the data available, the research available, the evidence, and the regulatory frameworks. And we're very pleased to have with us this morning Dr. Heidi Jimenez, who is the legal counsel for PAHO, who has been working with the technical teams. Her office has been working with the technical teams around the issues of health and law, and really ensuring that as we begin to look at the data and the information out there, that the rights-based approach to ensuring health and migration is well represented in our work. So Dr. Jimenez, Heidi, over to you.
Thank you, James. Excuse me, Dr. Barbosa, and good morning to all. It is really an honor and a pleasure for me to have this opportunity. And first of all, I'd like to thank the organizers and all of those that have collaborated in this important initiative for giving me the opportunity just to make some very brief introductory remarks. I specifically want to thank in this regard PAHO's Department of Health Systems and Services, and of course, my colleagues from the area of human rights and legislation for their excellent work and teamwork in this very, very important initiative and in this incredibly important field of work as it relates to health. On health and migration in the Americas is indeed a very important milestone, not only for the organization, but for the region of the Americas itself. As legal counsel of PAHO, I am extremely proud of my office's support and our efforts to build upon the capacities and understandings of the interrelations between international human rights standards, international human rights instruments, and their specific use of national legislations, policies, and programs to achieve the right to health in the Americas. This work is a clear example of what in PAHO we refer to as mainstreaming and cross-cutting work. That is, the way we use international human rights instruments and the way we work together with other technical areas, departments, and country offices to produce tangible and practical results that strengthens PAHO's technical capacities and have a real impact that benefit member states at the country level. In particular, I am especially proud, and I draw your attention to a series of publications that my office recently launched. It's entitled Health and Human Rights. The series includes 8 technical notes one of which specifically covers the topic of migration. This document contains detailed and practical information related to all existing human rights instruments and standards as they relate to the right to health and migrants specifically. This is but one example of the many efforts and strategies that we at PAHO have put together to collaborate and to render practical technical cooperation to member states, helping them identify what are the legal barriers that specifically prevent certain populations, in this case migrants, from having access to health services. It is our hope that these health-related legal tools will support member states, remove obstacles and barriers to health services by implementing the recommendations of the United Nations and inter-American human rights mechanisms. This initiative is also a reminder that PAHO's work will always continue to be guided by the principle that health is a fundamental human right to be enjoyed by every human being without distinction of any kind of discrimination, and which is an essential part of the Sustainable Development Goals, and specifically to the achievement of universal health coverage for all. The realization and respect of rights of migrants is a sound public health practice which benefits all across the board. The right to health is tied to the key principle of non-discrimination, which recognizes the inherent dignity of every human being, whether that person be local or migrant. A holistic approach to the right to health requires that development of national legislation, policies, and strategies must include migrants' health, their needs, and recognize their vulnerabilities. I invite you all to take your time to explore this online platform on migrants and migration, and also for you to take a look at the series, the technical legal series that we have put together, specifically the technical note that relates to migration and health from a human rights perspective. Now, allow me 1 second to introduce our next distinguished presenter, Dr. Pablo Seriani Cernadas. Pablo is a lawyer from Argentina with a PhD in human rights from the University of Valencia in Spain. He's also the director of the specialization on migration, asylum, human rights at the National University of Lanús, which is known as UNLA in Argentina, and is a member of the United Nations Committee on the Protection of the Rights of All Migrant Workers and their families. This committee, as you probably know, is the UN body that pulls together 14 international experts, independent experts, who specially monitor the implementation by state members of the International Convention on the Protection of the Rights of All Migrant Workers and members of their families. So without further ado, I am very pleased and honored to pass the microphone over to Dr. Seriani. Thank you very much for the opportunity. And I remain available if you have any questions as we go on through the discussion. Thank you again. Over to you, Dr. Seriani.
Muchas gracias. Thank you very much. Muy buenos días a todas y a todos. En primer lugar, quería agradecer la honrosa invitación que me han hecho para participar en el lanzamiento de esta importantísima iniciativa desarrollada por la Organización Panamericana de la Salud sobre salud e inmigración en las Américas, la presentación de esta plataforma informativa. Para mí, la verdad, es un verdadero privilegio ser parte de esta actividad y presentando esta importante herramienta que han desarrollado. Y en ese sentido no puedo empezar de otra manera que felicitando a la OPS por esta iniciativa, por la concreción de esta iniciativa, por el desarrollo de esta herramienta tan importante en materia de migración y salud, y que sin duda creo que puede contribuir significativamente al incremento de la atención de este tema, la mirada transversal de las temáticas de migración y salud, y en particular para orientar políticas públicas, programas, acciones, medidas concretas a implementar o para fortalecer las que se están implementando por diversos estados de la región. Quería dedicar estos minutos, primero, muy brevemente, para hacer alguna descripción de la plataforma informativa y luego, a partir de ahí, hacer alguna serie de comentarios al respecto. Esta plataforma creo que de manera inédita, ¿no? En primer lugar, condensa dos tipos de fuentes muy valiosas para cualquier actor institucional en la región y como recién se decía, desde la región hacia otras regiones del mundo, desde el plano de políticas normativas, por un lado, y luego del plano científico, del plano de análisis de esas políticas, de esas normativas, ¿no? Estas dos herramientas interactivas que presenta la plataforma, por un lado, a partir de la sección normativa, ¿no? Por primera vez, creo, por lo menos en mi experiencia, condensa todo un desarrollo de normas y políticas en los dos temas, y varios temas conexos a ellos, ¿no? Estamos hablando de dos temas con una característica de transversalidad muy, muy clara, ¿sí? Y sobre todo, creo que es interesante tener una herramienta de ese tipo, ¿no? En lo que tiene que ver con lo normativo, porque en la región, en los dos temas, ha habido un despliegue normativo por prácticamente todos los estados de la región muy interesante, muy fructífero, ¿no? Encontramos reformas en el área de la salud, como especialmente en materia de movilidad humana, leyes migratorias, leyes de protección a personas refugiadas, sumamente dinámico, ¿no? Si miramos el cuadro normativo de todo el continente, en lo que va de este siglo, prácticamente todos los estados han hecho cambios mayores, sustanciales, incluso adopción de marcos normativos completamente nuevos, o hecho reformas muy importantes en esa materia, ¿no? Y en prácticamente todas esas reformas se han incorporado disposiciones vinculadas a cuestiones de salud y al acceso a la salud de las personas migrantes y refugiadas, y de manera particular en muchas de esas reformas se han incorporado, como bien se describían las personas que me antecedieron en la palabra, las herramientas, una serie de principios y de estándares en materia de derechos humanos, incorporando justamente las normativas tanto del sistema interamericano como el sistema universal. Entonces, esta primera sección, que incluye más de 500 documentos de normativos, de políticas públicas, de programas de los gobiernos de la región, de los estados de la región, incluso recomendaciones hechas por organismos de protección de derechos humanos del sistema interamericano, del sistema universal, me parece que es una herramienta trascendental e innovadora, y que creo que en términos de difusión y de orientación a políticas puede cumplir una función
that can have a very important role in the dissemination of policies. And along the same lines, the other tool, the other dynamic tool of this information platform has to do with scientific production, the analysis of different institutions and individuals that have specialized in migration and health, and especially the link between migration and health, covering more than 700 documents that have been incorporated into this platform. And this is a work in progress that will continue actively by updating and complementing all that scientific work that is also key to guide policies and to show evidence and contribute to something that dates back many centuries in the area of health, but in the area of migration, this is more recent. I'm referring to the awareness of the pertinence, the relevance of evidence to influence policies. This covers different processes at the regional and global levels, such as the World Covenant on Migration, reflecting the increasing importance that states ascribe to the evidence and its value in migration policies. And this scientific dimension can also be a central function and role in this sense. based on these descriptive comments on this platform, which are merely a summary of a very comprehensive platform. And I have, in this respect, a few comments that reflect the importance of the tool that is being launched today by PAHO. My first comment has to do with something that states at the regional and global level have been emphasizing increasingly when it comes to migration policies. I'm referring to the importance of the holistic and comprehensive character of migration policies, meaning that the response of states to the issue of human mobility has to focus specifically in mobility, entering a country, obtaining a residence permit. These are the first aspects you think of when you think of migration policy, the use of the sovereign exercise of a state and to determine who will remain in its territory. Now, talking about this involves talking about all the rest of topics, the change in the composition of our communities, the integration and inclusion of migrants into society that becomes increasingly diversified. And such as Dr. Barbosa said, we are facing a really innovative and new regional context about human mobility between countries in the Americas region. And in this context, the social inclusion process, access to social services, health, education, housing, social cohesion, and other aspects, all of these have to be increasingly a central part of the migration policy for the success of the integration of migrants in our increasingly diverse societies, so that we can attain the SDGs in the area of health and social equity, leaving behind inequities. This type of tools really supports initiatives and debates about the cross-cutting aspect of migration policies, and has to do also with the change of narrative in migration, where the access to health by migrants is not only the exercise of a fundamental right. It's not only the exercise of the right to equality and non-discrimination. It is a basic tool to meet the public health goals of the different countries. It's not only a matter of rights, but of attaining goals, because that will translate into better development and better opportunities for those who compose a community, regardless of whether they have been born in that country or elsewhere. The origin of a person for the access to health is or should be irrelevant, because health policies have to be intercultural. They have to ensure universal care. So in this respect, this is also a very important tool. The COVID context, as has been said, is an unquestionable proof of the universal aspect of health, not only for rights, but to meet public health goals. It's a key tool to inform processes such as the Sustainable Development Goals, a process such as this week, central authorities in the area of migration are meeting in New York to improve the World Covenant for regular migration. And this also can be important for our platform to assess that process in order for us to work in the coming years in the process at the national, regional, and global level. States and different actors are working in the framework of that World Covenant.
And this tool also complements other initiatives of the Pan American Health Organization in the area of migration. For example, the technical notes on health and human rights published in 2021 by PAHO, including a technical note on health and the right of migrants. There, too, is some very valuable information in this context. I don't want to take much longer, but in any case, and with a constructive spirit, and realizing that this is a tool that is being launched not only today, but that is going to require ongoing work. It will be followed up on. It will continue to complement this very important tool. I think that perhaps the best thing would be to suggest a series of documents or information that could supplement this very important platform. Now, in terms of policies and regulations, and I think that this can complement, it can contribute to policymaking, has to do with the regulations, the programs, the standards of local governments. Both globally and in the Americas, we find that a very important role is being played in terms of receiving migrants by local governments. Perhaps they're the first to have contact with the migratory population in the region, and they're important in terms of assuring a welcome and providing access to services. So the decentralization of the health system means that the primary responsibility has been given to local governments. So there's some very interesting practices that we see in many countries in the Americas. Some developed these practices recently, others have practices that go way back, and the idea is to guarantee access to services, including primary health care. I think that this platform could benefit from gathering information on those practices of local governments, local entities. Also, I think that there are tools that have been developed by United Nations agencies, for example, in the area of health and migration, especially the human rights system. For example, the rapporteur on the right to health, the rapporteur of the UN on the right of migrants. They have prepared a series of reports that deal with migration and health. And I think that this could become part of the information provided by the platform as more and more information is brought into it. So these are important sources and could be important sources of information for the platform. And then lastly, perhaps in the area of scientific literature, something that could be incorporated in the platform is a whole series of documents and reports that gather evidence, that have generated evidence on health and migration throughout the region. This comes from players that you may not think of automatically when you talk about scientific literature, because perhaps those publications, those journals, aren't part of the best known publications, the ones that are indexed, that have to do with academia, that are produced by scientists, but also we use evidence that is produced in other areas, other actors, including the Pan American Health Organization. And here, for example, a lot of reports have been prepared in the field in recent years in response to the migratory crisis produced by migrants from Venezuela and Peru and Colombia, the High Commissioner for Human Rights of the United Nations, a lot of agencies that are working with national and local governments. They're gathering evidence on an ongoing basis, and that is very important information. It helps assess the policies being implemented by member nations in the region, that in terms of human mobility. So once again, I think that the platform will continue to complement this information, and it's a very valuable tool, and it would profit from including this scientific information produced by actors that we may not consider at first glance to be scientific, but they have engaged scientifically in gathering evidence that is important for the policies in the region to assure universal access to health for all persons, whether or not they were born there or in another country, whether or not they have a different nationality, but that are now part of our communities that are becoming more and more diverse. And by guaranteeing universal access to health, we have a better possibility of being able to implement sustainable development practices. So once again, thank you, and I congratulate you again on this initiative.
For your remarks, I think very clear as to the relevance, the pertinence, the opportunity that the platform presents for us, and moving forward an agenda around human rights, access to health and migration. I'm pleased now to actually move towards the presentation of the platform. What we've done is we've prepared a short video for you that will present the overall scope of work of the information platform so that you can understand better the overall objectives of the platform, what information will be included in it, and how the two dashboards that have been made available within the platform can be utilized by its users. So I'd ask the technical team now to present the platform. Thank you.
The Pan-American Health Organization's information platform on health and migration in the Americas. The information platform is an interactive digital repository that facilitates the dissemination and dynamic visualization of research findings on health and migration. The data presented are intended to guide policymaking, evidence, legislation, and humans, and be a resource for the design and development of training materials, public health projects and interventions, and health and migration research initiatives. The information platform is developed with the aim of strengthening health information systems that integrate timely and reliable migrant health data to develop public health interventions that adequately address their health needs, bridging the gap between research and policy development on health and migration, to ensure that decision-making is being guided by evidence, and advocating for migrants' right to health and their inclusion in national plans and legal frameworks. The information platform contains two interactive dashboards. One is related to policy, legal, and regulatory frameworks, and the other is related to scientific literature on health and migration. The data presented here can be explored by using different filters to analyze the information. Let's have a brief look at the dashboards. We thank the experts at the School of Law of the Universidad de Torquato de Tella in Argentina, and the Social Studies in Health program of the Institute of Sciences and Innovation in Medicine at the Universidad del Desarrollo in Chile for their immense contribution in the development of the information platform. We invite you all to navigate and explore the content of the information platform. All the content will be updated regularly, and we are also developing additional materials, including other dashboards.
Thank you very much. We certainly do invite you all to explore explored the dashboard to look at the data that's available on it, the research evidence, the regulatory frameworks, and begin to execute the necessary filters to begin to mine the information that you require. As was mentioned in the video, one of the central components of the platform is really the presentation of evidence for policy making. And central to this work has been the support of the Department of Evidence and Intelligence for Action in Health here at the Pan American Health Organization. We're really pleased to have with us this morning Ms. Adrienne Cox, who's our Senior Advisor on Health Analysis, Equity Metrics, and Evidence. So Adrienne, I'd like to hand over to you to present for us the vision of the department and your role in this overall initiative. Thank you.
Thank you very much, James, and good morning to everyone. I'm just going to share a quick presentation with you all. Okay. Says that the host disabled. Can you enable me to share, please? Great. Thank you. Oops, sorry. Sorry about that. Let me unshare. All right. Thank you. All right. In our region, we have many different situations and patterns of migration. One of the challenging things we have is having information separate for migration on migrants within our different countries that we have, and also shared information across countries. So when we look at our patterns of migration within this region, we see that they have increased over recent decades since the recession that was global in 2007. And if we look at migration, we really need to look at it in terms of the social determinants of health, if we're going to connect it to health. And we'll see that there is limited data on irregular migrants that access health within different countries and that access healthcare systems. So that main challenge is that we do not have migration as the social determinant of health, which is very important if we're going to look at equity and health. The current state is that we need more information and research on migrant public health, and we want to get to a desired state of using data to promote actions that lead to greater equity and health. In order to do this, we really need to develop systematic approaches to foster multi-agency initiatives dedicated to collect, share, document, and analyze information regarding migrant health and living conditions so that we can get to improving health and social political well-being within this population. Really, how can PAHO do this? What will make it possible? Really, we need to promote equity by strengthening data capture, improving the quality of the information, generation of evidence, so that we can use it to describe what is happening and advocate for greater health situations for migrant populations within countries and also inter-country. Also strengthen decision-making within this area for health policies to close these gaps and strengthen information systems, as one of the panelists mentioned earlier, to capture these various inequalities that we see within countries, particularly in this population. If we do this, basically, PAHO can be an advocate in promoting information interchange among countries and through other coordination mechanisms outside of the health sector as well. This is an example of what can be done if data does focus on this type of population. Looking at the Venezuelan population within Peru and a small sample that INE conducted of 9,000 people, we see that we have the selected characteristics of the Venezuelan population as they access health. So here we can see what profession they had. Most of them are professions coming to Peru that are settling, and then how they access health. Why are they going to access health? In this situation, it's mostly due to chronic conditions dealing with asthma, hypertension. But we see that the majority, 78%, did not receive any treatment. If we look at the morbidity among the 44% that did get treated for a health problem, 80% of these people went to certain groups within certain services within healthcare. However, half of them, a little more than half, went to pharmacies. And you'll see that only about 28% went to a health center, whether it be a clinic or other point of contact within the health center that we have. So you also see a good portion, about 35%, self-medicating. So they're not really having that type of access to health system and treatment that maybe the general population would have. There have been other studies that were done, smaller studies with other populations along border towns. And sometimes you see that the migrant population will have better access to health because of whatever social services are reaching out to health. So it's varied across the region. But this type of data is an example of what can be done if we advocate for specific data with healthcare on these particular populations. And that's really what I want to highlight here, is that we need to have effective data, reach out to other organizations for this type of data, and really build that evidence in terms of data and health in migrant populations. Thank you.
Excellent. Thank you very much, Adrienne. Very interesting information being presented. And as Heidi mentioned earlier on, the systematization of this information, of the incorporation of the data into the platforms, like the platform that we're launching here today, will be very important for our member states as we move forward in this process. Okay, as we come to the conclusion of this event, we have a very important presentation still ahead of us. And it's a perspective from the Health Emergencies Department at the Pan American Health Organization. Often we've seen the issue of the health of migrants within a context of health emergencies. And so it is really important that we look at this from the lens of the overall human rights approach to access to health, to ensure that we can protect individuals during the migration process. I'm very pleased to have also then Dr. Ciro Ugarte with us, who's the director of the Health Emergencies Department here at the Pan American Health Organization. And Ciro will provide us a presentation on protecting the right to health and ensuring migrants' equitable access to health, and also provide us with some closing remarks for the event. Ciro?
Thank you, James. Colleagues, it's a privilege for me to be the last speaker and trying to summarize some of the key interventions that we had here in this event, beginning with Jarvas, with emphasizing on the PAHO's work, in close relation with the member states and also international organizations, but at the core of PAHO's policies in this regard. And highlighting also the Santino's comments on the evidence and the research and how this can translate into action. And of course, the global, regional and country policies regarding migration and health. And from Heidi's comments on the key aspect of looking at the human right and the right to health when we are talking about migration, but also considering, of course, the local populations and other groups. And looking at what also Pablo mentioned on the this overall picture of national legislation across several decades, but also coming into fruition when we are talking about emergencies, particularly COVID-19 emergency that is affecting most of our countries still, and the protection of migrants, the production, scientific production, the access to services, and also several other linkages, and probably what we have heard from Pablo also, some new additions that may also improve the platform. And Adrienne also mentioning how can we also look in more detail some of the data that we are having and the countries are producing, specifying which are the challenges, but also the progress made by specific countries. So in these few slides, I would like to highlight some of the key aspects that we have been doing in the Americas together with health services, but also with WHO and other entities. And I would like to highlight, for example, in the area of leadership and coordination. PAHO has been leading the health working group of the regional interagency coordination platform for refugees and migrants of Venezuela. Actually, the chief of this R4B platform was here with us at the directing council meeting in front of all the ministers of health when he was just appointed to that responsibility, along with the chief of the IOM and UNHCR. So it is a close work that we have, along with many other partners and NGOs that work in several countries. But PAHO has acted also as technical advisor in all chapters of the Quito process. That is a process that is held by the Ministers of Foreign Affairs, but with close coordination with the Ministries of Health, particularly in areas that are related with mental health, the impact of COVID-19 pandemic, vaccination, and including, of course, vaccination against COVID-19 and many others. And also PAHO and the Ministry of Health, one example of that close coordination with Colombia, for example, led the health cluster with the participation of more than 70 partners and supported the establishment of 14 health coordination mechanisms at the subnational level. We know that the migrants are being located in areas that not necessarily have all the resources, so we need that coordination. And we see that there are several key leadership and advocacy actions and documents that you will see in the platform, including the report of the regional ministerial meeting on mass migration that was held here in Washington in 2019. And that report is also brings some key actions that the countries have been implementing, including the action among Venezuelan migrants, but beyond that. And a specific meeting that was a side event at the Directing Council of 2019 as well. Next one, please. We'll see that also in terms of technical cooperation, has been promoting the incorporation of protection of the health needs of migrants in national health strategies and plans, especially related to medical assistance, but all medical care and also COVID-19 vaccination, but beyond that. But most countries have included the vaccination of migrants as part of their national plans, not only for this emergency, but beyond. That's the most important, which is covered by the national health insurance in most of the countries. Although many migrants do not have proper health insurance, still most of the countries have included the migrants in the coverage that they have. But also we have been promoting the inclusion of citizenship as a variable of health information system at country level. Most of the countries did not have this variable when they were getting the data. So Peru, for example, has included it in the data system, as was presented by Adrienne, and we know more in detail what is happening in that regards. Next one, please. So access to health services. This is an example of what we've been doing with Colombia, the access to health services and supplies. It's very important, including vaccination, of course, also mother and child health, delivering hygiene kits, access to clean water, drinking water and basic sanitation services, and also access to mental health and psychological services. So there is a lot of data that is there and advances from several countries, but access to health services is being translated from legislation and research into action when we see how the countries are dealing with the migration. Next one, please. And there are also some technical cooperation around health services. We see, for example, the health centers that receive specific health technical cooperation to provide health access to migrants, and hospitals, laboratories, and others. And also we see how these actions have been implemented with the support of several donors, European Union, USAID, and the Central Emergency Fund from the United Nations. Next one, please. And also technical cooperation and training. You see the thousands of people that have been trained in some of the countries. This is just a brief summary of what has been done by the countries together with PAHO. Next one, please. And then we've been working very closely with HSS to the production of this course, the self-study training course introducing the regional strategic lines of action on health and migration that was approved by the ministries of health, but also that is being implemented by the member states. So this is an excellent area of work that we have. And in that regards, I invite you to register to this course. It's free, but you will learn many key aspects, particularly, for example, to identify the priority of migrants' health needs and apply their knowledge to advocate for using global and regional frameworks, and also to other key instruments in this regards. So I would like to end these slides just to make some additional brief comments. Can we end the slides, please? Thank you. So I would like to end my comments by thanking all the participants, but also with a reflection. The contribution of the migrants to the social, economic, and cultural development of the countries is proportional with the generosity of the countries that receive them. If the countries receive them and include them in the health sector, if they include them in the access to other benefits, including citizenship or working permits and others, the migrants will contribute highly to the countries that they receive them, but also will contribute to the country of origin. As we know, many countries in the Americas have important income coming from the countries that live abroad. And as the history of the Americas also is important in that regards, we have and we had many presidents that were sons or children from migrants. So when the countries give this priority, including the human rights, the access to all the services and the health systems and services, we clearly understand what is the way forward. And with the platform that we have, all the information on legal aspects, but also information on evidence that must be translated into action. And what their countries are dealing with this also on the day-to-day basis, I think we are in a good path, but we have to work together. The main actors on this are the member states and the local health services. And in that regards, when we are reporting all these data, of course, this data comes from the member states themselves, but we have to also include the organizations of the migrants. In several of those countries, the organization of migrants also have a key action and a key contribution to identify how their peers are looking at that. The perception sometimes is not related with the actual law or interventions, but the perceptions becomes a reality, not only for the migrants, but also for the populations that do receive them. So in that regards, I invite you to visit this page, use at the full extent of all the key information that is there, and also contribute in addition to any other comments, and please provide your comments and your contribution for this site that is at your service. Thank you so much.
Thank you very much, Ciro, for that overview and for your comments. I'd like to really thank all the panelists today, the presenters. It's been extremely informative. We really do invite you to explore the platform and as Ciro's said, provide us with feedback. Congratulations also to all the technical teams in HSS and PHE, EIH, legal, all these acronyms that we have here at PAHO. And we look forward to continuing this work with you. So with that, we'll bring this event to a conclusion. Thank you very much. Have a good afternoon.
Thank you very much. Have a good day.
Thank you.